Best Cost is a Horizon Europe research project funded by the European Commission looking at the health costs of air and noise pollution. In our podcast, we talk with the researchers involved to learn more about how their work can build the evidence for stronger policy action on pollution. This episode, we are talking to Vanessa Gorasso from Sciensano and Baravelli from the Norwegian Institute of Public Health on how Best Cost is examining how air and noise pollution worsen socioeconomic inequalities. Thank you both for joining the Best Cost podcast today. Excited to get into the topic with you both. But first, do you want to just introduce yourselves to the listeners?
Yes. Hello, everyone. I'm Vanessa Gorasso, a scientist working at Sciensano, which is the Belgian Public Health Institute. And I'm specifically working on the burden of risk factor, including environmental stressor, in the Belgian burden of disease study.
And I'm Baravelli. I'm from the Norwegian Institute of Public Health. I work in the Department of Disease Burden. I work a lot with disease burden, obviously, but also with a focus on social inequalities, which we'll be speaking about today.
Yeah, so one of the things about what Best Cost is looking at, of course, is the worsening health inequalities caused by pollution. So if I can ask you, why is pollution such a large contributor to worsening health inequalities across Europe?
Well, I guess we could start with understanding that according to the Global Burden of Disease study, that air pollution is one of the most significant environmental risk factors that affects both premature mortality, so when people die and when people die too early, and also how long they live in a state of disability. How is that associated to inequalities? Well, we know that air pollution affects different populations disproportionately, and it tends to affect socially disadvantaged groups more. And in so doing so, it contributes to larger socioeconomic inequalities that we observe persistently throughout the European region.
And just quick on that, just to test you, when you say it's socially disadvantaged, could you give some examples of who that might be?
Yeah, for sure. So obviously it's a complex question, and that's part of what we want to try to understand better. But sort of in general terms, when we refer to people who are socially disadvantaged, we might be referring to a group of people who have access to lower incomes, for example, lower household incomes. Specifically, they might, on average, have lower rates of education. They also might live in areas with greater deprivation. So we could say that they live in areas where there isn't the same material access there might be than in a more affluent area. So there's a lot of factors that sort of contribute to this idea of social disadvantage, but it's not just one single factor.
And so, yeah, with Best Cost looking at improving research methods looking into this, why are the current research methods limited in measuring health impacts from different environmental stresses?
So for the literature has, there's a lot of literature around the link between environmental stressors and health. So how air pollution, noise, and other types of environmental stressor affect our health. So we know that these kind of pollutants can cause cardiovascular diseases, respiratory diseases like lung cancer, asthma. And sometimes we see also there is a higher risk for diabetes. This is usually caused by stress, for example, for noise. So this kind of relationship is quite established in literature. And there has been a lot of studies around it. What Carlos explained before, the link between how the pollutants and then the burden is distributed around inequalities and how these stressors affect inequalities is still something that has a more difficult connection to make. And so more research needs to be done around this topic.
Yeah, so just to add to that we can think of like that social inequalities as an additional aspect. So people who might be already living in areas which have higher exposure to air pollution might also be the same people who have been living in sort of socially disadvantaged groups. And so they have sort of double disadvantage in us. Yeah.
Yeah, and Best Cost is kind of bringing together different elements, such as looking at the burden of disease, social inequalities, which we're talking about today, and cost monetization. So how is Best Cost bringing these together to improve the research methods?
So the Best Cost project is led by Sciensano, which has a national burden of disease study. So we are quite experts in developing burden of disease measures, which account for the impact that diseases have on the quality of life of people. So people that live with a disability for a long time, but also the burden of disease accounts for the fact that people die before their expected life expectancy or their expected end of life due to a disease. So the good thing about burden of disease is that we are able to compare diseases that have a long or there are a long chronic diseases for which people live long but with an impacted quality of life, for example diabetes or even musculoskeletal disorders, and we are able to compare this kind of diseases with diseases for which people die at an early life, for example lung cancer or cardiovascular diseases. So then we do a step forward compared to only having a metric that only looks at mortality, for example, because in this case then things like musculoskeletal disorders or diabetes would be overlooked because we only focus on diseases that have a big mortality impact. So this is one part of the three elements that you mentioned. Then there is a part about the cost monetization. So on top of having a value for the impact on the health and the quality of life of a person, we also want to attribute and look into another metric, which is the cost. So attribute like monetary value to actually a healthy life here. And this is quite relevant also for policy because it's a metric that it's maybe more understood at a political level, also considering the fact that there is a limited amount of resources, and so prioritization needs to be done also in terms of monetary values. And then I leave the floor to Carl to explain the inequalities.
Yeah, exactly. So I guess what's Vanessa's kind of describing is that best cost is taking quite a holistic approach. So looking at burden of disease, looking at the effects of environment and environmental exposures and noise, but also taking into account the socioeconomic impact and how that is related as well. So when we talk about social inequalities in health, we're essentially looking at the unfair reality that your health is heavily predicted by your background. So things like your education level, which I spoke about before, your income, and also even the neighborhood that you're living in and grow up in, these all sort of have an effect on your health. So if we lived in a perfect world, then actually it wouldn't matter. And that's probably like a situation we would prefer, that people, no matter what educational background you have, your health outcome would be unrelated to that. But unfortunately, we see persistently throughout Europe that unfortunately your social background does matter, and it has an effect in relation to burden of disease as well, and these measures that we use to measure burden of disease. Yeah, so in relation to best cost, we want to sort of measure this across all these different aspects, and we also want to take into account the cost as well, so that we can improve how we can monitor all these different factors that we know are related to health.
Yeah, and indeed, and in the next episode, we will be talking with some of the other researchers about to get really into the burden of disease and the cost monetization side of things. So today we're talking about the socioeconomic inequalities, as you've been explaining, like why this is so important to address as well. So with that, Best Cost has developed, and by Best Cost I mean you two, developed a multi-deprivation index to use at the European level. Can you explain to us what exactly is an MDI and why is it important to conduct these measurements at the European level?
So a multi-deprivation index, it's basically a way for us to map out where life is the toughest. It was actually started back in the 1980s in the UK to help governments figure out where to essentially send funding. So it has a sort of direct policy implication as well. So instead of just looking at sort of a single measure, so instead of just looking at income, for example, an MDI sort of combines several layers. So it takes a more complex picture. So it'll take into account, for example, low education, unemployment, poor housing conditions, or lack of material resources. And it looks at these at different geographical locations, so at the municipality or the neighborhood level, for example. And then when we look at social inequalities by using these measures, then we can both understand people who are impacted by social disadvantage. We can also understand groups that are, or geographical locations that are impacted more heavily by disease burden. And we can also understand the groups of people who have been heavily disadvantaged due to exposure to air pollution, for example. And if we can understand if these things are related or not, it becomes very important to a larger understanding of monitoring these factors.
Yeah, and we were not the first one to develop a multiple deprivation index. There are a lot of them available across Europe and different countries. But what we were trying to achieve is to have an MDI that can summarize inequalities for different European countries at the same time. So using indicators of deprivation that are common across different European countries, because the general framework and the general idea of best cost is to be able to compare the burden of disease attributable to inequalities and environmental stressors across European countries.
So it's kind of like understanding that inequalities are felt across Europe, was also specific to more local locations, essentially, right?
Yeah, there are different ways to measure inequality. And so traditionally, the multiple deprivation index has been used to understand inequality in relation to geographical location. And we try to measure this in small areas, so at the neighborhood or the municipality, but you can measure it regionally as well. And this usually has direct policy implications, since we tend to organize ourselves, both our health systems and governments based on these systems. And then we can also understand this in relation to why certain areas within a country might be doing better or worse than others. But we can also see that within a country itself, there's probably differences between individuals as well, based on their social background. But we're here, especially in relation to environmental stresses, more interested in these geographical locations.
I mean, as you said, like the MDIs first started to really look within a country and also to influence and advise policy. And so we know environmental stresses such as air and noise pollution, they're not just impacting at the local level, but of course we need more like international, like European level kind of action. So I guess this MDI that you've worked on can help advise on policy, like local level, national level, but also the European level.
Indeed, that's the plan to work at different. This is the plan to work at different levels. Of course, the higher area you're looking at, or the bigger area you're looking at, you might missing out on smaller differences at local level. So it needs also to be interpreted with caution.
Duly noted. And so yeah, we've already talked a little bit in detail what the MDI is, but I wanted to ask you, for our listeners who will be curious to know more, what are the different types of indicators that you used, and why is it that you selected these ones?
We both spent a lot of time on this.
Indeed. We started from a very long list of indicators because, as we were saying before, there are already deprivation indices available in Europe and other parts of the world. So we started with a very long list of indicators, and this can go from how your house, so the basic amenities of your house, things more like education, whether you own a car, whether you have access to internet. So it can go in different directions, but we wanted to have something that is comparable across different countries. And so at the end, the final list, or the final MDI, included 5 indicators, which were central heating, whether your house includes or has central heating, the education of the population, so whether there is a high percentage of the population that has higher than secondary or at least secondary education, employment, so also looking at proportion of the population that is actively employed, whether the amount of the proportion of the population is formed by a single parent household, and the change in the population, because we know that in areas where there is a big change of the population, so people moving from rural areas to cities, for example, it's also a sign of deprivation. And these indicators were selected looking at whether they were temporarily relevant. So things like owning a car or having access to internet, it was more an indication of deprivation in the previous years. And nowadays, not owning a car, not being, for example, owning a house, it's not a sign of deprivation. So otherwise, I would also be considered in the lower level of inequalities. Another factor that we took into consideration when selecting the indicators was the cultural relevance. So again, whether being a single parent of a household, for example, it's something that could be seen as a positive thing in one country compared to another because of cultural differences. And one big part of our choice was driven by the availability of the data, because these are very sensitive information, and it's not always easy to access it for all the countries. So a lot of the data for computing this index was based on census data, which is the most complete data collection for a lot of the countries with regard to this kind of indicators.
And especially what you mentioned about some indicators can actually become outdated or over time, and that's not always considered. But with this, I mean, the best cost methods, we are hoping that they can be used across time, even when the project is ending. And I'm assuming that's also why you picked the indicators that you did, that these are ones that are always like quite long lasting in terms of understanding people's levels of deprivation.
Indeed, I mean, we don't have we're not able to predict the future, but we thought we did a good guess.
We at least try.
Yeah.
That's all I can do. We've also been touching on what does all this research mean for policymakers, because I think you're the scientists, you're the experts, and sometimes getting all this data and numbers can be quite overwhelming. So I wanted to ask you, like, how is it that the tool can be used by policymakers?
Yeah, so in relation to policy, it's important to ensure that policymakers have information from a holistic and from a different aspects. So it's not just looking at the attribution of environmental stresses in relation to disease burden, but also understanding the relationship to social inequalities. So, for example, it might be very nice on paper that you're able to reduce the effects of certain environmental exposures by 10% nationally. But if we're not also trying to understand the vulnerable populations that might be more vulnerable due to additional social pressures, then this is sort of, a limited aspect to policy making. So it's important to have all the information, and that's why social inequalities is an important aspect to also include in the best cost project.
Yeah, I think also because, I think like in one area, maybe we can work on like reducing levels of noise and air pollution, but then that's going to benefit the people living in that area, but then those who cannot be in that area, then it ends up widening the social inequalities gap as well, as more people benefit if they can afford to live in a calmer, quieter area than those who can't.
No, exactly. And it does live. And so there's a lot of factors that go into it. Sometimes from policy, it can be difficult because there can be good intentions to maybe try to clean up an area, include more green spaces, and you get this sort of green gentrification that occurs in which people from lower incomes or who don't have the same access to be able to buy more expensive property, for example, might be priced out of those areas. So this is sort of more recent studies that have been looking into this. But at the same time, we also need this additional information to understand the groups that might also benefit from policy, both in relation to environmental exposure and also social deprivation.
Great. And then, I wanted to ask, because I think this was quite a big amount of work that you were doing to create this. So what was it that really motivated you each to work on developing this multi-deprivation index? Who wants to go first?
I'm generally interested in social inequalities in relation to disease burden. So these are two areas that have been sort of a focus of my personal research. And so the Best Cost project is an ability to sort of extend methodologies that we've used, for example, in different countries. So as Vanessa has mentioned, that Belgium, for example, done a lot of good work in disease burden, and we're using a lot of the work that they have done in relation to the Best Cost project. The same in Norway as well, that there's a lot of good methodological grounding. But at the same time, I see it as important. I mentioned before that we see these very strong epidemiological trends. We see it, for example, in gender, that we always know that there is a difference between males and females in relation to disease burden, that in absolute terms, males tend to die younger, women tend to have more disability. These are things that we see over time and across countries. And another very strong epidemiological finding is very strong, persistent differences between these social groups, both at geographical level, but also when we look at these groups independently. And there's sort of a justice aspect to this as well. It's not necessarily fair that people have a disadvantage in relation to their health just because of their social background. And trying to understand the mechanisms is very complex. So it's part of the fun as a scientist to try to understand. We have a lot of complexities. There is sometimes reverse causality, which we need to try to tease out, and it's not always easy. And at the same time, we want to maybe supply, in relation to policy making, the instruments to the policymakers to improve the situation so that, for example, these things become independent and that we don't see these persistent epidemiological effects of social background. And, for example, people can choose to have less education and less income, and that is independent of their health. That would be the ideal situation. So
Indeed.
Yeah, so for me, I was always working in my work. It was the first time for me where I was focusing on social inequalities. It was not always a part of the work, even of my work. Even of course, it's intrinsic in our estimate. So for me, it was quite interesting to learn from the long experience of Carl with inequalities, and also being able to share with other experts around Europe on methodological complexities for burden of disease, but also the assessment of the environmental stressors. So yeah, I think this Best Cost project was also a good platform to share expertise across different research groups. And I'm going to cite something that Carl once told me, and it really with me. He said that don't want everybody to be highly educated, but we would want that the non-highly educated people have the same health as the highly educated ones. And I think it's a really wise sentence, because we know that it's not possible that everybody has a PhD or a university degree, or this is not a choice for everyone, but unfair that these people don't have the same quality of life and often level of health than the people that have a higher degree.
Yeah, like the baseline shouldn't be like the bare minimum. Of course, it should be quite a high standard. I also like hearing that. I mean, this is such a huge and important topic, but I do like hearing that scientists can have fun still while you're deep in the research, exploring. I also like the fact knowing now that one of you has like done more work on socioeconomic inequalities, and one of you is quite new to it. So, because I think that's going to make my next question quite interesting to hear your answers, which is, well, was there anything particularly challenging you found about the research for Best Cost that you were doing that you would like to share with us?
For me, the biggest challenge was that we had to make things simple for a topic that is very complex. So we know that there is a link. We know that these links exist, and we know that the strength of this link, but it's not always straightforward. It's not always linear. And for our research to then come up with a number, we need to make things a bit simpler, also for them being able to translate this for policymakers. So for me, the biggest challenge, but in research in general, I think this is a problem, that the word is very complex, but we need to come up with something simple to be able to arrive to a conclusion and to then use this for policy making. So this is my biggest challenge.
Yeah, I agree with that as well. I think also another challenge that we faced in this project, and specifically with developing the multiple deprivation index for Best Cost, is that we wanted to develop it for, we had 5 case countries that we were interested in doing that were quite different from each other. And we tried to kind of choose indicators. So Vanessa spoke earlier about like the indicators that we chose to include in this sort of composite score, that is the multiple deprivation index, and the reasons why we were motivated to do that. But we also kind of tried to choose things that are kind of relatively universal and have like meaning across the countries. But of course, context is important, and we do see that there are some differences between countries, and sometimes it can be a little bit difficult to tease out where there's real differences, and sometimes where those differences reflect differences in how these things are measured. But we are lucky that at the European level we do quite well at measuring all the things that we're interested in the Best Cost project.
And the case studies we'll also learn more about in another episode from this podcast, so people should stay tuned. But my last question to you both is just quite simply, what has been a personal highlight of the project for you? I say simply.
Maybe this podcast.
Good answer.
That's the correct answer. I think it's that we get to work collaboratively with fantastic institutions, fantastic scientists, people who are motivated in the work that they're doing, and that people put in a lot of work to try to ensure that we're doing the best with what we have. But definitely like all the different collaborations between the different research units and universities and everything.
Yeah, I totally agree with that. And maybe I can share a highlight that happened last week, where I was presenting Best Cost to the IONET network, which is a network that includes different scientists working on environmental research at European level. And I was presenting the Best Cost project, and the head of this network was really complimenting Best Cost and saying that he was a big fan of the project and on how we disseminate our results. So I think this this is quite a nice highlight, and probably the podcast, and would also be a dissemination tool for the results.
That's great to hear. I mean, also so rewarding for you both when you've done so much research, and it's good. Like, it's nice to know that people are really paying attention, and you get to have these conversations, and you can totally share this podcast episode with them after. Thank you for listening to this episode on the cost of pollution from the Best Cost podcast. To learn more about the project, visit best-cost.eu or find us on LinkedIn.